The pharmacy system is outdated, and it's time for a change. OptumRx is introducing an industry-first transparent pharmacy care model with a pricing approach where clients pay a monthly, per-member fee for services that is independent of manufacturers' list prices or prescription volume, and digital tools that help consumers compare pricing. It's a smarter model, built to work better for everyone. That's how OptumRx continues to reset the standard. Learn more at optum.com/transparency.
By age 35, Aaron Ellis was making a name for himself in the music industry. With such a vibrant professional and social life, it just made sense that his romantic life would fall into place as well. But when he met a woman at his local gym and sparks flew, Ellis didn't realize they'd eventually burn hot enough to brand permanent scars.
The control started very early, but I literally would justify it as caring about me, as ways of loving me. Now that I look back in the therapy I've had around domestic violence and coercive control, I see now it was controlling. But I literally told myself it was, oh, she loves me and cares.
They were 1 month into their relationship when the physical abuse began. At least, that's when a friend of his first witnessed the abuse. For Ellis, much of this time is a blur.
I do remember just thinking, okay, she's small. She can't really hurt me. I'll be okay. Even with a black eye and stuff like that, I said, she didn't really mean to hit me that hard. And the other thing, though, I think that's more important is that I honestly would tell myself that it was better than the psychological abuse. And I would rather have her hit me than do all the other things she was doing to me. And I think that's probably one of the toughest things that I've had to overcome and help other people understand too. Because ultimately, the abuse can get really bad. And I've actually talked with other men, and I've had a concussion and stuff that was really damaging to me. But I still was like, man, it's way better than all the other things she was doing. I think the mental and emotional scars were tougher to deal with.
Ellis is part of the 40 to 50% of victims of intimate partner violence in America. Many people are shocked to learn that men make up nearly half of this demographic, since much of the awareness campaigns and programs are female-focused. Dr. Denise Hines is the Enochs Professor of Social Work at George Mason University's College of Public Health. While each case is unique, she says that the physical, sexual, emotional, and psychological forms of abuse remain consistent regardless of which gender is perpetrating them.
What you might see some differences are that men are more likely to cause damage when they engage in physical abuse than women are. But women sometimes will try to equalize the average strength differential by using some sort of household weapon, like a knife, a hard object, those kinds of things. They also might try to attack their partner physically when their partner is vulnerable, like when he's sleeping or taking a shower, in a situation like that, or if he's had too much to drink or is in the bathroom. So those are ways that women have tried to equalize that strength differential. But essentially, abusers will use whatever tactics are available to them to use in order to abuse their partner. And so we see more similarities than differences.
Hines published a 2025 study looking at the experiences of male victims across America, Canada, Australia, and the UK. It's a tough group to research because the men first need to be willing to speak up.
In the United States and Canada, for example, these are self-report anonymous surveys. They're not from any official records or anything like that. So it's calling people up and asking them behaviorally specific questions like, has your partner ever kicked you? Has your partner ever punched you? Has your partner ever beat you up? And so we do see higher rates of both men and women reporting victimization when you ask the questions that way.
The data gets a little bit murky when it's pulled from domestic violence agencies or law enforcement reports.
You'll see a lower percentage of victims are men because men are much less likely to come forward. And there's some Canadian data specific to that in their survey that shows that a significantly smaller percentage of men who are victims of partner violence come forward compared to women who are victims of intimate partner violence.
Hines says there are a few different causes of this underreporting. Yes, stigma and shame are huge factors, but awareness is often an issue in this community.
The men are much less likely to really recognize that what is happening to them is intimate partner violence or domestic violence or abuse. And so they're much less likely to think that they need some help. They're more likely to say or to think, my partner needs help. She needs some help because she's behaving this way. She needs to get help rather than he needs help because of the things that are happening to him. So there is this inability to define what is happening to them as intimate partner violence, largely because it is framed as a women's issue.
While many people have a hard time understanding the abuse that's occurring, Hines says it's a much more exacerbated issue in male victims. She believes some of this hesitancy comes from the fact that violence within relationships has long been equated to exclusively being a woman's issue.
I went to this talk once where they talked about how in countries that have gendered languages, right? So everything gets a gendered pronoun, that the word victim is feminized in all of those languages. So it is an inherently sort of feminine term. And so it's difficult for men to come to the realization that they're victims. And then the added shame. If you look at it in popular culture, right, there's a lot of laughing and there are sitcoms based around men being hit and being attacked by their girlfriends or wives, and it's considered funny. There's a lot of blaming him. What did he do to deserve it? They're aware of all of that messaging and the stereotypes and the norms. And so it is much more difficult for them to come forward.
And when they do decide to speak out, it's not always received with empathy. Hines's research revealed some pretty harsh realities for men who try to seek help.
So about half of the agencies said to the men that they only help women. And this is across all of the countries. A minority of the agencies, so just over 40% of the agencies did the things that they're supposed to do, which is believe them and tell them he didn't deserve it. So that's pretty low. And about 40% also told him bad things, like ask him what he did to deserve it or made light of or fun of his story. So, they're not really doing the things that they should be doing to validate and advocate for and help these victims of domestic violence. And that's across the several countries that we assessed.
Hines believes a lot of these systemic issues stem from how these programs were initially set up.
I mean, these agencies were developed and spearheaded way back in the 1970s and really took off in the 70s and 80s. And they were built on the idea that domestic violence is something that men do to women, and that it's the underlying cause is the patriarchal structure of society and men doing whatever they can to maintain their power and control over their female partners. And so when people are trained in that model, it's hard to then take a man who's calling and saying, my wife or my girlfriend is doing this to me. It's hard for them to take him seriously.
We can see how gendered this issue is even in the names that lawmakers choose for their bills. The 1994 Violence Against Women Act funds programs that prevent intimate partner abuse. Despite its name, the law stipulates that any VAWA-funded programs must serve both male and female survivors. But Hines says that doesn't always happen.
There's not enough funding to support the women who are victims of domestic violence. And so to say we're going to expand and include everybody, I think makes a lot of these places nervous that they just don't have the capacity to do it. So technically, every agency has to provide services for male victims. Now, whether that gets translated onto on-the-ground service provisions is questionable because we do see a lot of men who say they are turned away. So the people who are answering the phone perhaps do not have the training to understand that they're supposed to serve everyone who calls and says they're a victim.
Thankfully, her research shows that this may be improving. There seems to have been a shift over time where men who've sought help in recent years are reporting better interactions than in the past. And when men reach out to these survivor programs, Hines says many of them seem to be looking for legal help.
They are concerned that if they do leave or if they are leaving, that they won't see their children again, that she will use the children against them in divorce and child custody proceedings and make sure that he doesn't see them again, that she'll levy false allegations of abuse against him, either abuse that he abused her or that he abused the children or both, to try and make sure that she maintains that power and control over him and that she will keep abusing him in whatever way, whatever power that she still has over him.
When Ellis left for the second time after having 2 children with his abuser, this fear became a reality.
From when I left November 3rd until, last August, about 50, I think 53, but 50 plus false allegations against me with DCF, which that's CPS in Florida. None of them resulted in a judicial order where I couldn't have my kids. Every single one of them was investigated and dismissed. She also tried to file things in court that were not true, besides the DCF reports and everything. So yeah, she went down that, and it resulted in me not seeing my kids for 404 days. No photos, no nothing. And I went from being a full-time dad, homeschooling my children, making them every meal and eating with them, cooking with them traveling with me whenever I traveled, to not seeing them at all. And it was horrific. It was horrible.
And it was just the beginning of Ellis piecing his life back together. Join us next week as we dive deeper into the healing journey for victims of intimate partner violence and the impact it has on the children involved. You can find more information about Dr. Denise Hines, Aaron Ellis, and all of our guests on our website, ingoodhealthpodcast.org. For more behind the scenes, follow In Good Health Pod on Facebook, Instagram, and X. Our executive producer is Amira Zaveri. I'm Kristen Farah.
It only happens every 4 years, and this time it's here. The biggest tournament in the world. Stadium shaking, flags waving. This is history, and you want to be there. But real life can make it tough. Work, busy schedules, and the price. That's where Priceline comes in. Priceline has millions of deals on flights, hotels, and rental cars so you can go see it live. So find a great deal and make the trip happen. Rally the crew, go see the game live, turn your dream trip into reality. Book now with Priceline.
On the under $3 menu at McDonald's, a McChicken is $2. Because when you're craving a McChicken, you deserve a McChicken. And now, that McChicken is just $2.
Limited time only. Prices and participation may vary. Prices may be higher for delivery.